Hey, everybody. Welcome back to the Outcomes Rocket. And I'm super excited to be doing this interview today with the outstanding Dr. Gabriel Pagani. He's a Mayo Clinic-trained, double board certified interventional and surgical pain management neurologist with a mastery of axial and peripheral fluoroscopic and ultrasound-guided procedures, neuromodulation, surgical device implantation, minimally invasive sacroiliac and lumbar spine arthrodesis, and extensive research experience. The topic we're covering today is really a continuation of the topic we've done around chronic low back pain. And in today's episode, we're going to be focused on the military, the options, results, and opportunities for this particular very important population. So Dr. Pagani, thank you so much for joining us today.
Yeah, thank you for having me.
Of course, of course. And anything on the intro that maybe you want to fill in that I might have left out?
No, I mean, that's a good summary of what I do. I work predominantly in the military population, although I do work in the private sector. I've been an early adopter, certainly, of Reactivate, particularly within the military community. I have had really good results. It's an underutilized procedure, which is common with novel technologies. And I'm excited to talk about my experiences, talk about what it's like, and in the hopes of, spreading awareness and adoption of Reactivate.
Yeah, no, I appreciate that. It's a great opportunity. So let's dive in. Can you describe the prevalence of chronic low back pain among military personnel and how significant the issue is?
I mean, the significance cannot be overstated. It's even in a non-military population, chronic back pain is overwhelmingly number one cause of disability, and quality of life reduction worldwide. And in the military population, it's probably even further, unfortunately, enriched with this problem of chronic axial low back pain. What we know is that military service, military training, whether you're deployed or not, does stress the spine. And many of these patients have had, or veterans or active duty personnel have had some kind of injury, maybe severe, maybe trivial. But what these injuries have in common is that they tend to shut down the nerve supply to the multifidus muscle, which is the main stabilizer of the spine, and also the main proprioceptive sensor of the spine. And that what that means is that it's responsible for telling the brain where the spine is in space. So if you have had this multifidus knocked offline because of an injury, then your spine doesn't really know where it is. And, the symphony, if you will, of muscle contraction that is meant to take place to protect our spine is not, being conducted appropriately. And so activities that shouldn't cause pain, like sitting without back support, bending forward to pick something off the floor, et cetera, because that spine stabilizer is not engaged or locked in. And, as a curiosity, multifidus muscle dysfunction or atrophy has been known forever, but it was sort of treated as a curiosity, meaning, that's there. It's associated with back pain, not much to do about it. But now there is something to be done about it. And, I think it's a real game changer in the military community.
Yeah. Thank you, Dr. Pagani. I really appreciate that. And really just, thinking about observations, experiences regarding some of the effects of this chronic low back pain on soldier performance, mental health. What comes to mind to you when you see it?
Well, that's a multifaceted question. So if you have somebody who's active duty and really, does not want to leave the military, but is having this kind of crushing low back pain, I mean, that's an issue. So some people may be forced into an earlier retirement than they would otherwise want. And some people just kill themselves to stay in longer, sacrificing everything and just having a great deal of suffering as a result. And then, of course, once you leave the military and you become a veteran proper, you still can have major quality of life issues. These people have worsening mental health because they cannot function the way they want to. Can't do the job that they identify with, can't perform as a spouse, as a parent, as a child, just not able to fulfill role obligations. And, it's a major quality of life and functional impairment for a lot of people.
Yeah, for sure. As we've been having some of these discussions, Dr. Pagani, this topic of multifidus dysfunction often overlooked comes up, in the diagnosis of the treatment. Uh, how does that happen, and what can listeners, look for or think about in identifying this correctly?
Yeah, again, it's never been really appreciated fundamentally as a like a single diagnostic entity. Like, oh, my back pain is because I had multifidus atrophy and dysfunction. It was always sort of treated more as a correlation thing, not really a causation thing. In fact, it does not even have its own diagnostic code. Like there are different codes when you bill in medicine. There is no code
Mm.
for multifidus dysfunction, so it's really not yet recognized. And that's one reason why we need to do the things that we're doing today to increase recognition, increase awareness. And of course, those things take time. And what was the second part of your question again? If you can rephrase that for me.
Yeah, no. So I think you really covered it, because it was really about how do we target it, and I think you've kind of a reiteration on your end is that it hasn't been right, because it's been sort of a
Yeah.
secondary thing, and so a great call out, and then the point you made around the codes, certainly, on the payer side of the equation, if you guys are listening to this, something to think about when you take a look at the long-term care opportunities as well as cost implications of these types of procedures. Certainly something to think about as an option to reimburse. And
It,
so, oh yeah, go
and
ahead.
let me piggyback, Saul, on
Yeah.
the cost implication, because that's very interesting. And the company Mainstay has had some publications on cost benefit analysis, and that'll be something that they will continue to study. And obviously, it's of paramount importance in healthcare as cost becomes more of a concern for everybody involved. But really, this problem of axial nociceptive back pain related to multifidus dysfunction caused by multifidus dysfunction does not have other good sustainable treatments. So these patients are undergoing a lifetime. Historically to date, these patients have undergone a lifetime alternative treatments, really with not a great track record of success. And they can range from less invasive, right, physical therapy or nerve blocks or set radiofrequency ablation, to frankly more invasive types of things like a surgery, like a big time decompressive spine surgery, or even opioid medications with all its attendant risks and consequences of that. And so it is to not treat this effectively, it becomes costlier, not only for the patient, but for the payer, and, Reactivate is really the only treatment out there for multifidus dysfunction. And it is supported by, phenomenal longitudinal research, 5-year randomized controlled trial data. And patients do very well with it. And some have even had the device removed because they don't need it. They're cured. And that is an extremely rare thing when it comes to neuromodulation, where, things we do in the spine, usually people don't say, I don't need it.
Stays in there, right? It just stays in there forever.
Yeah, it stays in there, and, it does its thing, but, they are dependent on it. But some of these patients, they're able to kind of rewire things, bring the multifidus muscle back, reverse the abnormal inhibition from the brain, and have the device removed. And so, I am convinced that, in appropriately selected patients, obviously, you pick the right patient and you have the right therapy, that it is not only, a major benefit to the patient in question, but it is cost savings for the payer in general. Obviously the cost savings aren't going to be realized for minimum 1-2 years, right? Because there's upfront cost with implant with surgery. Yeah. But certainly over time, I don't think it's going to take very long to hit, net even. On as far as, what you would have spent not doing it.
Totally. Yeah. And I've had a chance, thank you for that, Dr. Pagani. I've had a chance to speak with patients on this series, and actually a previous series that we did. It's real, folks. And by the way, in the show notes, I'll link up some of those patient testimonials so you guys could hear directly from some patients. as well as Dr. Pagani today, because the opportunity to change the landscape is here. And so, any personal experiences, Dr. Pagani, and how your patients have responded to this?
Yeah, I mean, my patients have done very well, and what you need to do is counsel the patients that, the benefits do take time, and they do accrue better and better with time. So you can have somebody begin to respond in weeks, but it's really a months-long slog. And there are reports of people needing a year or longer for this to work. And, so the patients will need to turn it on faithfully, 30-minute sessions a day. So there's some compliance expectations and, need to patiently wait expectations. But, I've had very good success with it. And again, these are patients in whom there was really no great alternative therapy. So, and sometimes when I talk to other physicians and they may be hesitant to adopt something new, that's always what I say. I was like, what else are you going to do? What else? It would be different if there was a bunch of competing, very established, very effective therapies out there, but there really isn't. This has a niche to its own. And so, yeah, my patients have done quite well. And, hearkening back to, you mentioned mental health, one of my earliest implants is one of the ones doing the best. And again, that's because he was one of the earliest, because the benefits do take time.
Yeah, they build up.
Has, told me how much his mental health has responded. And mental health was not something he had even bothered to discuss with me.
Wow.
Back when we were evaluating, he was kind of keeping it internal, and he sort of, without going into details, did tell me that he was in a dark place. His mental health was bad, resorting to alcohol, trying to cope with pain, not doing well at his job, needing to take a sitting break every 15 minutes. He's a younger guy in his 30s, not used to this kind of, he's in his 30s for Christ's sake, right? Not used to this kind of disability. And now, he's living a life on his own terms. He doesn't need to take any breaks. He doesn't need to really change the way he needs to do anything. He's a 35-year-old again, essentially. And, so when you restore the function of the spine with this and when you eliminate the pain, there's a bunch of knock-on benefits, mood. Now you take somebody and they don't have a mood disorder. They're more productive member of society now. They're working more. They're paying taxes now again. All these things, everybody benefits really. The whole, not just the individual, but the whole system, our whole society, everybody benefits when you restore somebody with Reactivate like that.
Yeah, it's huge. Thanks for sharing that. Certainly a big opportunity in the way we treat this, and like you said, Dr. Pagani, when you're out of options, to have an option is fantastic. So the call to action for some of the providers out there is let's be open to this opportunity to restore multifidus function and overall just lower that chronic low back pain. This has been a fantastic discussion. I've really enjoyed our time together. What call to action would you give in particular to VAs out there, military healthcare providers, about this type of treatment for this very important community to our society?
Yeah, again, like we discussed earlier, the penetrance within the military community is low, and frankly, the penetrance is low outside of the military community as well. People are coming around to Reactivate more and more and adopting the technology, and there is just by definition, a lag always, whether you're military or private sector. There's always a lag when there is a new technology that works as far as adoption, right? So I guess the call to action would be to really consider this. If you're somebody who treats patients with chronic axial low back pain, and probably any physician is going to raise their hand. It might not be what they primarily treat, but that's going to be a comorbidity among patients they see, just because nearly everyone has back pain. So call to action is basically keep an open mind. Always, no matter what it is, technology-wise, always do your due diligence to teach yourself about the underlying research, because sometimes new technologies come out and they don't have any research at all. But Mainstay Medical has been out nearly 2 decades, I believe, as a company that, even though the Reactivate has not been commercially available that long, because they have spent so much time doing research and doing their due diligence to prove that it works prior to rolling it out. So this Reactivate is a minimally invasive and if needed, fully reversible surgical procedure that can really address the root cause of chronic axial low back pain. And a significant percentage of those people who have chronic axial low back pain, a significant percentage of those are people with multifidus dysfunction and atrophy causing or at least exacerbating their chronic back pain. And, basically get these patients to somebody who knows about Reactivate, and more VAs and more, private hospitals will be doing this, of course, but the pace is slow, as it always is, of adopting new technologies. But, there's a disservice being done by not knowing about it and not offering it. So the slower the pace of adoption, the more people continue to suffer unnecessarily. So I guess that would be my call to action.
That's great, Dr. Pagani, and thank you for being an innovator in the space and seeing the possibility of a technology like this and the way that it improves lives of really the people in our country. So really appreciate you. Thank you for joining us for this session, and looking forward to chatting with you again soon.
Oh yeah, I'd be very happy to come back out here and talk about whatever you want in healthcare. But thank you very much, and thank you for doing your part. There's so many stakeholders in healthcare. You're one of them. Thanks for doing your part to kind of spread awareness. Appreciate it.
My pleasure.